Okay, the purpose of this video is to show ultimately the posterior branch of the obturator nerve. This is the near the pubis, that is the urethra. That is the ASIS way up here. The cadaver's head is up there. This is the left leg. I'm looking across the right leg to the medial side of the left leg. For orientation, this is fascia lata. This is saphenous vein. This is the sartorius. As we come over here, we see the saphenous nerve on top of the femoral artery on the lateral side, eventually crossing over to the medial side. This is the nerve to the vastus medialis, entering the teardrop portion of that muscle. Just following along to continue the review of the saphenous nerve here for a minute. As you go down, it crosses over. This is the vastoadductor membrane that's been cut. So this saphenous nerve then comes through, eventually going over that tendon of the adductor, which forms a hiatus through which these vessels are going through in order to go into the popliteal area. The saphenous nerve then stays under like a little tiny fascia here. This is the sartorius. Ultimately, it comes through here as the this being the patella. You can see if you draw a line down here, the sartorius curves up, gets real thin. The gracilis tendon is right in here, kind of, and then the saphenous nerve comes through that, in between those two, and exit. Right now it's staying under a fascia. It does have a lot of branches that come under the knee. It should be remembered that these are very close to the bone and they are under a fascia, so if you do a field block over here thinking that you're going to get it by staying just in the adipose, you will not block that nerve. However, one of the branches finally does meet up with the saphenous vein here, typically about mid lower leg. So now we're going to go back to the medial aspect of the thigh and look at the obturator nerve. This muscle here is the, first of all, under the thumb is the pectineus. This is the adductor longus. This adductor longus was incised so that you can see the anterior and then the posterior branches of the obturator. So I'm going to move my hand back there. This again is the anterior branch of the obturator nerve. This is the posterior branch of the obturator nerve. The anterior branch kind of goes through under the adductor longus and kind of works its way towards the gracilis, which is what this is. So it exits kind of between the adductor longus and the gracilis. Now then, there is a branch here which has a tie around it. This tie is really just around the entire posterior branch of the obturator nerve. As we go down here, this tie here is on a long, very long branch of the obturator nerve that cruises kind of along and in the adductor, but it is definitely under a fascial plane here, See how it's under the fascial plane of the adductor longus? See this fascial plane here? Definitely under that fascial plane of the adductor longus. Then keeps going, keeps going, keeps going. I'm going to pull back now to give you an idea. There's the patella on the upper right. We see that this is the gracilis here. This is the branch of the posterior obturator nerve that's cruising through and in and kind of on top of the adductor magnus, definitely under this fascia of the adductor longus there. So then we try to find out if does it really go into the adductor canal. So here is the fascia overlying the sartorius. And the sartorius is here. And then this is kind of the saphenous nerve cruising through here. This is the vasculoadductor membrane. And then I'm going to pull this in. So this tie is tied to the branch of the posterior obturator nerve that's kind of cruising along with, and if you see that little line there, it's right under my finger, right under my index finger is the branch of the posterior branch of the obturator nerve that seems to go into or below or near the adductor canal. I guess you could call it the adductor canal. It's going to go kind of crossing the arteries. And across the arteries underneath. To go into the popliteal fossa under the artery and vein, and I suppose eventually go to innervate some of the posterior aspect of the knee. Now, whether or not this can be actually blocked as part of the adductor canal block really remains to be seen, because this nerve is deep to the vein. So it's deep to the femoral vein. Okay, I'm going to show that once again. So I'm lifting up both the artery and the vein, and the artery is on top, and the vein is in the middle, and that you can see that little tiny nerve is going under both the femoral artery and the femoral vein, and is crossing them, going into the popliteal fossa, but it is definitely under the vein. So I would say that actually being able to block that nerve and saying that it's in the adductor canal might be a stretch. Again, the saphenous nerve is here, and the vasculoadductor membrane is here. And so we're typically trying to get local anesthetic on this side of the artery to block the saphenous nerve, given the fact that the ultrasound is here and it would be near you, and then the vein would be in further, and then the nerve to the of the obturator that's going with the femoral artery and vein into the popliteal fossa. Now, I would say it's kind of crossing under the femoral artery and vein. And going into the popliteal fossa. And I suppose it's cruising through. And then this should demonstrate the nerve here. Again, there's that adductor longus right here. This is the fascia, and it's above the adductor magnus. And then this nerve had to be kind of dissected out of the muscle of the adductor. And then it finally crosses about here, which you can see using the patella to kind of gain an understanding of where we are. So that's the relationship of the patella there. Probably I would say about 10 centimeters from the middle of the patella, where this nerve happens to be crossing, and this nerve is over the adductor, which is contributing to that tendon, which is creating the hiatus being right here. See, I'm pulling on that tendon, and so that adductor that I'm pulling on right here is part of the adductor that's contributing to the tendon, and then the nerve is going over that part with the femoral vessels into the popliteal fossa. But certainly it would be on top of the vein when you looked at it from behind, but it's under the vein when you're looking at it from here. It's definitely crossing. Here's the artery, and typically the vein, so the artery and then vein and then nerve. So it'll definitely be under the vein at that point. So vasoadductor membrane, saphenous nerve, sartorius, adductor tendon, pulling the adductor tendon here, looking through there, and that would be one way of finding it, I suppose, is by finding that little nerve that would cruise over that adductor right there. Here's that adductor again. Femoral artery. Femoral artery, femoral vein, branch of the adductor, right here. There's the adductor contributing to that tendon. This is probably a genicular artery, maybe. This is the sartorius. This is the saphenous nerve here. Remember, there is a vasoadductor membrane, and generally speaking, a membrane. And this one. Here it is. See the striations in that? That's how that looked. You can see how the saphenous nerve kind of comes out. Probably the genicular artery. Stays under here. Sartorius muscle. Gracilis. So again, adductor longus, brevis, very tiny nerve, cruising under that adductor longus muscle and its fascia, cruising kind of through the adductor magnus and over it, and then finally crossing in here. So there it is there.